for Tobacco Control in Africa and the Kenya Tobacco Control Alliance for their tremendous initiative to organize these events. Today marks the beginning of a series of webinars that will bring together the World Health Organization World No Tobacco Day 2020 awardees to share their knowledge and experience. These webinars aim to create opportunities for the African tobacco control fraternity to learn from the awardees and get inspired by them. As the beginning, the World No Tobacco Day awardees will be giving us a general overview of tobacco control in Africa, and the specific thematic areas will be developed in the next 3 webinars. I hope we all will be very empowered and inspired to move the tobacco control work an extra mile in our respective countries. Well, I don't want to take too much of your time. I need to leave the time for the awardees to introduce themselves to all of you. And today, I ultimately believe that it will be a day of fun and full of learning. Again, and a very warm welcome to each and every one of you. So, before I give the floor to the awardees, I would like to kindly ask you to write down your questions and the comments, as we will only be able to allow them at the end of the session. I would like to give the floor to Mr. Wondu Bekele from Ethiopia.
Thank you for having me. I'm a human resources manager by profession, and I joined the war on cancer after I lost my son due to leukemia. He was about to leave for Washington for bone marrow transplant. He couldn't make it. He passed away while he was under treatment at the Black Lion Hospital. That's how we formed our society. We came to realize that forming our society is the best way to remember him, and we formed our society in our residence, in our living room, and I was forced to hold 2 jobs simultaneously, with a tobacco company with a very good salary and incentive, and with a cancer society without any salary. And for about 6 years, we worked like this, without any admin cost, without any salary, without any house rent, what have you. Then become a conflict of interest as soon as we started conducting anti-tobacco campaign in selected schools here in Addis, with the money we received from UICC, International Cancer Union, and then become a conflict of interest. I have no option but to choose between the two, between cancer and our society. Finally, I resigned from my tobacco job on my own free will, and joined Matthews Wandu Cancer Society on full-time basis. As you can imagine, our society is working on several focal areas. Childhood cancer is one because of my son. We are also working on women cancer because of its predominance, because it accounts for about 60% of cancer incidence in Ethiopia. The third focal area is tobacco. Why? Tobacco is the single largest preventable risk factor. And 4, we also focus on non-communicable disease because of the risk factor we shared with them. So our society is very busy with support we got from CTCA and ACBF, and to a certain extent from ADCA, also from American Cancer Society. We have been collaboratively working with the Ministry of Health and Ethiopian Food and Drug Authority, a regulatory body for tobacco and other products. We have been supporting them for the last 6 years to domesticate a framework convention on tobacco control in Ethiopian peculiar conditions, particularly after the framework convention on tobacco control ratified by our parliament 3 years ago. We have been very busy. As you know, this convention without taxation is not as good as we think, And last year, we were busy supporting Ministry of Health, Ministry of Finance, and the regulatory bodies without having any support from anyone. And I remember we formed United Front on tobacco, particularly on imposing heavy tax on tobacco and alcohol and other products like sugar and salt. Toward this, we have to fight with the industry, including alcohol and tobacco. They were jointly fighting us through Chamber of Commerce and other means. And I remember at one time our State Minister of Finance, he was surprised to see well-organized civil society, organized from the Ministry of Health, from regulatory bodies, academicians, addict experts, and policy champions, journalists, actors, and what have you. So finally, we managed to have one of the strongest law on tobacco and alcohol. And 6 months ago, we also got a reasonably high level of excise tax on tobacco and alcohol. So one of the reasons I'm nominated for World and the Tobacco Day Award is the proclamation and excise tax, which was passed and ratified by the Parliament. But as you can already know, I myself is a tobacco addict for about 17 years, and working with the tobacco industry enabled me to advocate for bigger issues like cancer in general and the non-communicable disease. And I'm also a focal person for Consortium of Ethiopian Non-Communicable Disease here in Ethiopia. Because of this, we received several awards at international level, and I think this will give us some kind of recognition, not for me in person, but the United Front I am leading and coordinating, because without them, without the support of the Ministry of Health and the FDA, WHO, Ethiopia office, and other partners, it will be impossible to reach this far. Thank you.
Thank you very much, Mr. Wondu. We are just bowing admiration of what you do, of your work. It is very, very interesting and inspiring. Is it possible that you give us a general overview of tobacco control in Africa, and a kind of just a one or two lessons from the work you did, from your experience, just to make sure that we get at least 2 or 3 learning from your work, from your experience?
Non-communicable disease, and in general, I will share you the report we just produced on non-communicable disease, including injury and the case for investment. I'm sorry to tell you that Ethiopia and in general in Africa, we are more exposed to non-communicable disease, and it is because of tobacco. And as you can see, the tobacco industries are coming to Africa and Ethiopia in particular, like Japanese Tobacco International. And from what I see, it is becoming no man's land. I'm sorry to tell you, this time is for Africa and including Ethiopia, but our leaders, including international organizations working around Africa, they are not seriously coordinating our response, because non-communicable disease is no more a health issue, it is becoming a development issue. Africa is the most exposed for non-communicable disease, and I'm sorry to tell you that Africa is the least prepared, and we are not doing enough to challenge the growing burden of tobacco and other risk factors for non-communicable disease. And I'm hoping that our leaders at one time, they will realize that what the tobacco is doing it is totally preventable. and our people are needlessly affected and dying from tobacco epidemic. I'm not sure whether what we do on tobacco alone can reach us anywhere. As you can see, tobacco is one of the leading risk factors. I know it is preventable, but unless you do on cancer in general and non-communicable disease in particular, it will be very difficult to. This is what is happening when we go to universities in regions. They say, why only tobacco? Why are not you are working on alcohol? Why are you not working on unhealthy diet, obesity, inactivity, and other risk factors? So what I'm saying is, tobacco is, I know, the single largest preventable risk factor, but to be successful and consolidate our achievements on tobacco, we need to go further and work on non-communicable disease and cancer in general.
To keep to write down their questions, and in the case there are some questions to ask you, we will give them some the last minute so that you can provide them with the answers or clarifications. So by now, I'd like to, I'm honored to have Professor Kumako Vignon-Kozo from Togo. Congratulations, Professor. We are so pleased to have you among us. And now we are going to hear from you. You are going to inspire us, to inspire the African tobacco control family. So, because I don't want to take too much time, and I know you are very busy, I would like to invite you to introduce yourself, to tell us what was your work, the work that make you win the award, and you will also give us a general overview, the way you see the tobacco control work in Africa, and at the final step, you will give us some 2 or 3 lessons that you want us to hear from, that you want us to get from your experience. So the floor is yours, Professor. You are welcome.
Donc, je suis le membre du bureau africain de la COP depuis bientôt 4 ans, puisque la COP devait se tenir cette année, mais
for tobacco control program in Togo. I'm also the member of the African board for about 4 years now, because COP was supposed to be held this year, but because of the COVID-19 pandemic, it was postponed. We tried to work a lot for the country, and also we work for Africa. Now in Togo, I am the focal point of tobacco control since 2011. In this regard, we have some legislation passed. We also have the government to take decrees and also decision by the ministers, and these laws are enforced thanks to the FTCT. This is a very simple legislation that we have in Togo, easy to understand. We work with the civil society, and the civil society support us a lot in everything we do, and WHO. And that's why in Africa, Togo was one of the leading countries working a lot with the civil society organizations, WHO, and the government. So there are a kind of synergy through our actions, and the civil society could not criticize us because we work together with them, hand in hand with the civil society organization, because we know that the civil society, they are the voice of the people, and since the government as well has also taken the concern of the people at heart, so the commitment of the government is there. This also helps us to make headwinds. And in 2007, we were one of the leading countries in terms of the implementation of the convention, and these help us. And Togo, or myself, I was selected as a member of the board to represent Africa, because it was realized that Togo was well committed in tobacco control activities. Now, globally, the lesson I learned since I got involved in this is that you need to be committed yourself. First, you need to be committed yourself. And this commitment will need to work hand in hand with the civil society, which is very important, with the WHO as well. Given the fact that the WHO, the WHO offices, they are also representing the FCTC, that helps us to work a tripartite work: government, WHO, and also the society. And we're working together. We sit around the same table to see the best option. And at the end of the day, I will present that to the government, and the government will sign, and progress was made in the country. This is what we've been doing so far. That's why today I was nominated for these awards. So it is like a football team or a soccer team. For instance, Messi is the best player of the world, but he cannot play alone. He is helped by the rest of the players. And if there is no civil society, if there's no commitment of the government, we may not be able to make the progress, and I cannot be awardee to that. So the commitment of all those stakeholders is very important to give the result that we have today. Do you want me to continue in English, or is it fine? Prof. Vincent, you can continue in French, no problem. We had everything you done and your track record in terms of tobacco control. For now, we have two questions for you. Would like to get your comments. How do you perceive the tobacco control in Africa today? And if possible, can you give us a few lessons that you would like to share from your experience? Thank you. So you still have the floor, sir. Since I got committed for tobacco control, the first thing that I realized that Anglophone countries are making more progress than Francophone countries. I know that the Anglophone countries, my impression is that they are more committed than the Francophone countries. I said it earlier at the level of the Civil Society Organization, and also the WHO, and also the FCTC level. So maybe we should find a way of coaching. We need to find a way to see, based on the language of the country, the progress is not the same. It's true that the Francophone countries are trying their best, but they are behind the Anglophone country in terms of the implementation of the convention. So we are learning from the Anglophone country like Kenya, like South Africa. So we learn a lot from Mauritius as well. They are a bilingual country. So we used to learn things, listen from them, because they were using English and French. Their documents were already translated into French. We even wrote to the government of Mauritius to get a few documents from there that can be replicated here. You know, some of the challenges we have is that the commitment of the government help us, so that those tobacco industry representatives that used to come to the government or to the Prime Minister office, they cannot corrupt our leaders anymore, because they are well aware of the dangers of tobacco use, and this helps us to make progress. And because of that as well, today in Togo, I said that we work together with WHO and the civil society organizations, so this unity of action helps us to be able to boost out the tobacco industry. And this helps us as well to really have a case before the government and to put forward the health of the people before the government. And government is really committed to promote the health. So the lesson learned is that when you work together with the civil society organization, as you work shoulder to shoulder with the WHO, this helps us to make major progress. But if there are some rivalry between the government or the representative of the government and the civil society, this cannot help us to make progress. So we work a lot on our parts with the civil society organizations. So we are happy to continue working with the civil society organization. This helps us to have a general overview, a global overview on the issue, and also make informed choices. By so doing, the civil society cannot criticize us, because by criticizing us, they are criticizing themselves. So this is a major lesson. Working together with the WHO and the civil society. The other lesson, we need to get the buy-in of the government. We succeeded in getting the backup of the government. This helps us to get good results. Now with the COVID-19, it is a bit difficult because their attention is focused, all the resources are focused on COVID-19, and because of that, we don't have resources to make progress. It's true that South Africa made good choices, and this they got a lot of good results. When the tobacco industry took the government of South Africa to the courts, the judges rule in favor of the government. So when the government is committed, everything is fine. It is up to us as tobacco control advocates to convince our leaders to get committed by our side, and this can help us to have major progress in tobacco control and working together with the WHO and civil society. This is all I can say as a lesson, basically. Now, finally, it is about the commitment, our own commitment as stakeholders, because if you are well committed, if you are strongly committed, you work selflessly, you give out your time, you give out your energy, you give out your leadership for the advancement of tobacco control. This is what I can share as a lesson learned. Now, other lessons, I said it earlier, if I say that we work with the civil society, we also, our colleagues, I learned a lot from our colleagues from Kenya, and we work together with the Kenyans, with Mauritius, with South Africa. This helps us to make progress in our country because we copy their best lesson that we replicate in our countries. Yes, we are working a lot as Francophone countries, but we need to learn from Anglophone countries. That's why we need to learn from those Anglophone countries, and this can help us today to make headwinds and for tobacco control to be well appreciated as a priority for the government today. Thank you. It is a pleasure for us to know that Francophone Africa, though they are lagging behind, we are happy to have committed people just like you. Yes, you giving us a lot of assurance. Thank you, sir.
Ms. Rachel, we are so pleased to have you. We are so pleased that you accepted our invitation and that you are going to talk to us. The African Tobacco Control family is so happy to receive, to hear from you, to get inspired, to receive your lesson, and to learn from your experience. Please, Rachel, the floor is yours. Introduce yourself. Tell us what was your work, the work that you did to win the award. Give us a general overview of how you see the tobacco control in Africa. And at the end, you will provide us with just one or two lessons that you want us to get from your experience. You are welcome, Rachel. Your experience, your work, your background is such a huge class that we would pass through, that we would need to learn from. For now, the next one to talk to us will be Miss Lobina Katili-Timba from Uganda. Please, Miss Lobina, you are welcome. You have the floor is yours now. You can come and introduce yourself. Tell us what was your work that made you win the award. You will also have to give us a general overview of how you see the tobacco control work in Africa. And at the end, you will provide us with just one or two lessons that you want us to learn from your experience. You are welcome, Miss Lobina. The floor is yours.
Be here today, and I know that it is not just my work, it's been the work of my team here at Uganda National Health Consumers Organization, but also our partners who have supported us, particularly CTFK and ATCA, who have brought us this far, but also our other partners in Uganda and global. I think for me the award was a pleasant surprise when I saw the award talking about protecting young people, but I have to say that I have been in the right to health. I have worked for the right to health, protecting patients and citizens in Uganda for over 15 years now. So my work also focuses on empowering communities and policy, getting policy to reflect the rights-based approach, but also to protect the people that government serves. One of the things we did was to have a patient's charter in Uganda, which spells out the rights of patients, and this is what we have used to say that patients have a right to free and fair and clean air and environment. So in 2012, we were approached by CTFK to support the advocacy for tobacco control. So we began work on the policy in Uganda and the act which was passed in 2015. We were largely supported by both CTFK and ATCA in different ways. And this led to us winning the Bloomberg Philanthropies Award in 2018 in South Africa at the Tobacco or Health Conference, and that set us apart. I also have to say that our laws in Uganda, the Tobacco Control Act, is perhaps one of the strongest in the region. It bans areas for smoking. We even put children above the age of 18, which allows you to vote in Uganda. But what we said in the law, that even if you can vote, you have to be 21 to sell cigarettes, to smoke cigarettes. So I think that contributed to the award I received for protecting children. So as a child of 22, whether you are at university, in the Ugandan law, you are not allowed to smoke or touch a cigarette. We've done a lot of work. I've done a lot of work in controlling children in schools. And I have to say that a lot of support came from ATCA, because we did a study with ATCA that looked at big tobacco tiny targets, which shows the might of the tobacco industry targeting our children and killing many children, initiating them on tobacco, but also allowing illegal import of tobacco in sachets that is not even marked. And we toured the slums and demonstrated how young people are influenced by the tobacco industry, and I think that is where the award came from. And I was pleasantly surprised once again with another award after the Bloomberg in 2018, and we have since celebrated with my team. I also have to say that the Ugandan law, the pictorial warning is 65%. So I think that legally for Uganda, we are not doing badly. I think for me, the lessons that we see here are that, you know, there is very little support for tobacco control, and this has been mentioned all over, but also I think the link between the tobacco and non-communicable diseases has not been highlighted. I think we have a lot of work to do to demonstrate the relationship between tobacco and the non-communicable diseases. I know we talk about it and it's in the figures, but it is different from going to people and explaining to them. I saw that the information we gave Parliament in Uganda, for instance, that you look at your children at 18, they are at university, yes. They are in secondary, yes. But whose money are they smoking? Why are we allowing? And Parliament saw that evidence, although it was already out there. But we gave it such force that Parliament eventually began to look at their own children and look at how smoking, even those who smoke, even those who grow tobacco also stood up and said, no, we must push the age up to 18. And against the force of the tobacco industry in Uganda, we agreed to the age of 22. So I think we need to communicate differently. I think we need to be agents of change rather than put information out there. But as we know that tobacco industry is largely, tobacco advocacy and prevention is largely supported by few groups. So we need to expand the resource base for supporting tobacco control, whether it is local input or global. We need, I think, to speak. If, for instance, you win an award on this, what is the next step? And that's why, for me, I was happy to see, and I must show that we are grateful for this meeting, because usually it dies away. We need to follow up. If you have done well, so what next? How do we carry this forward? I think sustainability for tobacco control remains a challenge, and that is what I have learned, and we need to find a mechanism. And we have to know that donors like to fund coalitions. I think we need to build coalitions to be able to seek for resources to continue, and information is the most important thing. And I think, as I've heard in Kenya, strengthening the regulations so that they don't seem to support tobacco control, yet they are not really supporting impact and change. I think those are areas that we need to strengthen and ensure that funding continues, that information continues, that advocacy is also continuing, but also that the partnership, like we have seen in here, also is strengthened, because when we are together and we can learn from each other, and we can compare notes, but also we can work together to raise resources, it makes all the difference. I want to thank you for this opportunity. Over to you, Chair.
Thank you very much. As you know, I think Africa can be proud, and we have got so very much powerful people who can help the Africa move an extra mile the tobacco control fight. Is there anyone who would like to make a question, or to ask a question, or to make a comment? Or in the case, if the awardees would like to have some more to talk, anyone is welcome, just raise the hand. Okay, Christelle from Cameroon. You are welcome to ask your question or make your comment.
Christelle du Cameroun. Ma question va à Rachel, parce qu'elle a commencé à parler de l'avenir de la...
Thank you for the opportunity to ask the question. My question is to Rachel. You talk about the future of tobacco control in Africa. I didn't get you right because my connectivity was not good. Rachel, can you tell us how do you perceive as a stakeholder, what is the future of tobacco control globally in Africa, Russia? And also, Grace, you talk about the commitment of the government. In my country, I can confess that we have a few challenges regarding the government. So, Grace, can you provide some advice to me? Grace, how can the stakeholders in tobacco control work with the government? Yes, we are doing that in Cameroon with C2TF, but our results are not what we are expecting. So, we need more advice from you. First of all, my first question was, what about the future of tobacco control in Africa? And still, what advice can you give to tobacco advocates to work better with the government? Because the government is the one in charge of passing the bill. We're waiting for the bill to be passed for 10 years now in Cameroon. Thank you.
In Kenya, some of the countries that have got guts, and then also because of the growing population. So even if prevalence rates remain the same, because the number of people for whom 10% is calculated, if it's 10%, is still big. So unfortunately, tobacco use is going to continue to grow in Africa. And that therefore means that in terms of a future for us as tobacco control advocates, we still have got a lot of work to do. In terms of government commitment, as I had mentioned, I think more and more governments are showing their commitment, but the tobacco industry is equally active. And given that there are now new and emerging products, and so in addition to the traditional cigarette, you now have shisha, you now have e-cigarettes, you now have even the ones that don't even have nicotine in them. And the other day, Philip Morris actually indicated it wants to get out of cigarettes into e-cigarettes. So there's a huge tobacco market out there. Therefore, there is a lot of work for tobacco control advocates to do. In terms of how to get your government to take action, one of the things I learned as a tobacco control advocate is what I call the dotted line. Now, the dotted line is, in English, some could call it a kitchen cabinet. And so there is the people that you know, and then there are people behind those people. So for example, what helped us in Kenya to get the FCTC ratified, because people like Dorcas had been working on that for a very long time, 2-3 years, no ratification. And then suddenly our first lady, and so our first ladies would be a dotted line, because in the picture of government, typically first ladies, spouses of ministers are not really written into a government structure, but they can be very influential. Now, as a woman with a husband, I know what you can do to a man at night when he comes home, and the next day he's going to do something. And so first ladies are some of those dotted lines. There could be other people who are not politicians, but who are influential. And so when you're struggling to get the ear of your president or your prime minister or your minister for help, and you followed all of the official channels, you now need to look for a dotted line. Who can you talk to so that they can talk to them and get them to take action? And so in the case of Kenya, our first lady was visiting the cancer ward at our major referral hospital. She was shown the section with children, and she was really disturbed. And she asked, what can we do to help these children? And someone very cleverly, I think you'll remember him, Dr. Ahmed Ogwell, told her, there is one thing you can do for us. There is a paper sitting on the desk of the office of the Minister of Foreign Affairs. It needs to go to New York immediately. That paper was a ratification of the Framework Convention on Tobacco Control. And so the minister had sat on it. He had refused to sign the document of ratification. And so by talking to the First Lady, she promised that a cabinet meeting was going to be held that next week. And she went and talked to her husband. And that same day, a cabinet meeting was called for. The Minister of Foreign Affairs was told, send what needs to be sent to New York. And Kenya signed and ratified the FCTC in one day. That is the power of the dotted line. So I think in Cameroon, you may need to look for a different kind of strategy. So follow all the official channels, lobby those as much as you can, but also find who else is influential, who could be able to help to get the ears of your politicians.
Such clear clarification. I've got also one question in the chat channel. Mr. Joel Gitari from Kenya is asking, as the panelists say, we need to really fight together. Better of mind has already taken root at our universities. Can the panelists tell us whether they know it and how they can join our fight against it? The question goes to all the panelists, the awardees. I hope they are listening and they have seen the question. Is there someone who can contribute to the question?
I agree with all nominees' comments on how we are progressing on tobacco control in Africa. And what I'm saying is, for example, in Ethiopia, if you take non-communicable disease, we are getting only 1.5% of our national health budget, which is only 6% of our national budget, which is well below Abuja Declaration, which our leaders agreed to set aside 15% of our national budget for health. And I'm sorry to tell you that non-communicable disease is costing Ethiopia $1 billion every year, which is like 1.8% of our GDP. And 52% of our people are dying from non-communicable disease, mainly due to tobacco and other risk factors. What I'm saying is, in Africa, we are talking about ratification, policy, and what have you. Let me tell you, one friend of mine from Norway told me that we in Africa, we are talking about policies. Policy without resources, poetry, my friends. We have so many policies. We have many ratifications. We have many documents, guidelines. But these guidelines and ratifications and the policies requires money. And I'm not sure whether GET Foundation, CTCA, and SCBF continue to fund us in doing our core business. These businesses we have our own share from our national budget. And in Africa, I'm sorry, we are not getting enough attention. The commitment that we are talking about is like, it's only a futile commitment. If they are committed, they have to adhere and they have to give us something like 15% of our national budget for health. Otherwise, if you take Ethiopia, 36% of our national budget is from overseas. Only 30% is coming from government. And how can you implement the proclamation I'm talking about, which is one of the toughest in Africa? We need money for the Minister of Health, regulatory bodies, and what have you. So with the money we are getting from donors, I'm not underestimating their generous support, but we want money from our national budget. That is how we can make a meaningful intervention toward challenging the growing burden of tobacco in Africa. Thank you.
Mr. Abubakar, you are welcome to take the floor. You will have to introduce yourself and tell us what was your work, the work that made you win the award. You will also give us your general overview, your overall overview of the tobacco control work in Africa. And after that, you will provide us with just one or two questions or one or two lessons that you would like us to get from your experience. Mr. Abubakar, you are welcome.
We'll be working to pass a bill, and also we're working 2019. So we, as a network, we carry out a lot of awareness creation activities in a primary school, secondary school, in training institutions, in universities, in higher education, to create awareness among the youth against tobacco use. And we also have some champions in the school that continue the awareness creation activities with the youth in the various schools. We also organize conferences every year, conference to really encourage the youth and the consequences of tobacco use. So So now we succeed also working with our municipalities. A few measures have been put in place in the municipalities we send some letters to the police stations for our actions and our activities, and also work on the use of shisha among the youth, and also designated smoking areas, and some do smoke cigarettes and also shisha everywhere. So there is awareness creation that continue toward the youth, and also helping them to discontinue the use of tobacco products. We also ask for the support of the police station to support us in order to sensitize the youth on the negative impact of shisha. So, well, we work in collaboration with WHO as well, but we are limited because of lack of resources. That's why we cannot do much more as we do want. But we're doing as much as possible to reach out the health institution and also education institution, primary and secondary education, awareness creation with some other institution organizations are also conducted. And also we have a conference, we have some specialists in nomology that we do invite to talk to the people and to the youth, especially regarding the negative impact of tobacco. So we still continue. We conducted a survey in 2013. We have a 15.8% of the youth that smoke, 35% of men, and 33% of women. So we have also a survey conducted in school setting, and this revealed that 23.9% from 13 to 18 years are using tobacco products. That is 88% of boys and 32% of girls using tobacco products as per the finding of this survey. So we work basically among the youth regarding the negative aspect of tobacco use. We focus on primary school as well, and also in a secondary school, and also training institutions. In Mali, tobacco is the major cause of non-communicable disease, and it accounts of 38,000 deaths per year. Like I said it, and also we have some laws, decrees that are taken, but the enforcement is really limited. So we can not really enforce the laws and the decrees. Even the committee that was put in place by the ministry is not fully functional. It is an interministerial committee where all the ministries are represented, but it is not really functional as per the modalities defined. But be that as it may, we continue working, basically carrying out activities among the youth. And so this committee, we are really pushing forward to continue the activities. So, so far this year, we've organized only a single meeting. This was due to lack of resources. We also do invite the civil society, but the problem that we have is a lack of resources so that we can conveniently carry out all those activities. I've sent some pictures of activities that we conducted. We also conduct sports events, sport activities for the youth. We also have advocacy with political decision makers, and also we are also conducting a lobbying and advocacy so that the bill should be passed, not only passed, but the enforcement of those bills are also very crucial in pertaining to us. This is all I can say for now. Thank you so much.
Mr. Abubakar, again, I'm welcoming you back to the floor. You are welcome to answer two remaining questions. The first one is, what is your general overview of the tobacco control work in Africa? The second one is, what are the 2 lessons that you want us to get from your experience? Again, when you are talking, please try to take the mic closer to your mouth and try to speak a bit louder so that the audience can hear you very well. You are welcome, Ms. Abubakar.
Merci beaucoup. Je vous remercie beaucoup. J'ai dit
regarding tobacco control in Africa, either the civil society activities, political decision makers, we have a lot of challenges in terms of our activities. On the side of the decision makers, some countries are still lagging behind. For instance, in Mali, we have challenge to make progress because we don't have enough resources to really carry out the control as it were. Yes, we have some bill passed, but we have issues about the enforcement. So the people need to be aware of the existence of those laws, and we need to sensitize them. And for that, we need resources. And they need to know also the laws. What are the laws about? They don't know that, which is another challenge. They don't really know what we have in our laws or the contents of the laws. They don't know the legislation. They don't know even the legislation do exist. So we need to have a major awareness creation for people, first of all, to know that those legislation exist, that people should not smoke in the public places. So we have a lot of challenges regarding that. And again, African countries, we need to work in synergy for a common tobacco control action. We need to have regional meetings, sub-regional meetings, so that the various countries should be on the level playing field and same level of information for information sharing, so that countries that are lagging behind can also follow suit regarding the tobacco control. Some countries are really far ahead, some are behind. I know that we have laws regarding tobacco use and also the marketing of tobacco products. So in Africa, the African Union should also take some decision on the marketing of product and taxes on tobacco products. And if you have taxes, this will help us to avoid tobacco on the market in Africa. And the young people will not have access to the tobacco. If the price is high, the youth cannot buy that. Increasing the taxes so that importers will reduce their tobacco shipment to Africa and some other tobacco product as well. So this is very important. So the KETCA should work in this direction, having an advocacy with the African Union so that decision may be taken. Without that, it should be difficult for us to do that as a single country, every single country. But we need to come together. Let's join our forces to have a synergy of action so that together as African Union, we can voice our position, and so that we should avoid deaths related to tobacco use. Now, the second question that you put to me, our experience, what are the lessons learned I hope I got the question clear. Our own experience in Mali, if this was your second question, you know, in Mali, we do a lot of awareness creation. Even the tests and the laws that I've just mentioned are not enforced. People are smoking everywhere at any time, even in public administration. So the law number 10033 of the 12th of July 2010 on the use and marketing of tobacco products, in this law there are a few sections that say that smoking in public places should be avoided. People even smoke in hospitals, in health facilities. They smoke in the offices. They smoke at the parliament. They smoke, you know, that's why we are conducting advocacy at the level of the municipalities with the member of the parliament and also the parliament, so that measures should be taken and this law should be enforced so that we can really reduce the tobacco use and can really encourage people not to smoke in public areas. And if this is done, even in school, you know, people even smoke in school. That's why we put in place tobacco control clubs in each school, secondary school, in almost all the school, secondary, primary school, we have tobacco control clubs so that when they are in the school compound, they should not smoke. So the clubs are there, they are watching over so that cigarettes should not be sold in the vicinity of the school, so that the children cannot buy the cigarette there. We are working on that. The clubs have been put in place, and they are also watching over the compliance of those legislation. And also we have also advocacy with the mayors. Some mayors have taken decision in their neighborhood, in their municipalities, to impose a ban on smoking in public areas, even the smoking of shisha. You know, shisha, people are more and more using the shisha. Even the girls are smoking shisha. So we send letters to the police station, letters to the municipalities. There are patrols that are now conducted to check the compliance with those legislation. And we've been encouraged, and all the municipalities are encouraged really to replicate that in Bamako. This is done. So now, like I said it earlier, we really don't have enough resources to do all, but we're doing as much as possible. And I said that, and if only we could really work together with ATCA, working under the leadership of ATCA, the various associations, all under the banner of ATCA, coming together on a common front, having a platform together and sending requests to the African Union so that the African Union can impose on the decision makers of our various countries so that our legislation may be enforced. We, the civil society, we are there to support the government for the implementation of those legislation. We are doing as much as possible with the scarce resources that we have. We're trying as much as possible to do group awareness creation programs and also the youth sensitization. You are well aware of the fact that, you know, the young people are now using tobacco, the young girls in primary school, in secondary school. That's why we are really doing a lot of sensitization there, because if we don't conduct any action, this will be difficult in the future to control those people. Well, like it said, we need to have a national tobacco control committee. In Mali, our committee is not fully operational. If it were functioning, the tobacco product should not come into Mali, because we're going to check all those things. And if we can improve or increase the taxes, and if the custom also are working together with us, this can help us to go a long way in tobacco control synergy at the African level, so that we can really put an end to this plague. Thank you.
Final notes from the panelists. I would like to come back on one question that was asked by Mr. Haja from Madagascar. His question is there one African country that collects funds, that collects and use funds from the tobacco control? Or is there any one African country that is actively funding the tobacco control? I would like Ms. Rachel to help us with this question, if she has got some good information about that.
So the first is to earmark tobacco taxes. So currently how taxes are collected is that even the taxes that are collected from tobacco are not necessarily plowed back into tobacco control. So when you earmark, and how other countries have done is to put it on both, say, tobacco and alcohol, then a certain percentage, which could be, say, 10%, must come back to tobacco control. But what we have done instead in Kenya is to actually put a levy on the tobacco industry. So what we have in the Kenyan tobacco control law is what we call a solatium compensatory contribution that is to be paid by the tobacco industry, and the rate was fixed in regulations at 2.5% of all their revenue in a given year. And note, this is revenue, not profits. So your revenue authority and your Bureau of Statistics can calculate. So for Kenya, because BAT is headquartered in Kenya, it is possible to calculate how much money they made in a given year, and they are supposed to hand over 2.5% of that. So we found that that was more likely to net us more money than looking at the taxes. And so it was written into the Tobacco Control Act as it passed, and then the 2.5%, the amount, was passed in the regulations. So that was part of the reason they took us to court for so long, because they were resisting paying that money. But now that the case has finally been determined at the Supreme Court, there is no more appeal they can file. And so the government is working on the modalities of collecting that money. And so for any of you who are willing to try that, it is something that I would recommend, because as I said, given the tobacco industry will be with us for quite some time, then that is a sustainable source of money, and the Ministry of Finance collects it. So those of you who are worried about Article 5.3 and taking money from the tobacco industry pays taxes anyway. So we are merely collecting 2.5% of what they make so that we can pay the costs of the disease that their product causes. And so anybody who would like a copy of the Kenyan law, we can forward it to KETCA, and people can try and see if they can enact that in legislation.
You see, now we are at 3 o'clock, and we would like to end up by here. But before we conclude the session, I would like to invite the panelists, to invite the awardees to make their, to make kind of, to make their last word on their words on the webinar, to make kind of conclusion, words of conclusion on the webinar. You are welcome. You are welcome. Who is available? You are welcome, Rachel. You are welcome to conclude, to make your final notes, your final comments, and then I will hand over the floor to the other one of your colleagues.
The tobacco control fraternity in Kenya, especially DOCAS and ILA, for the opportunity that they gave me. I could not have done what I did without all of them. And then to encourage all of us that despite the challenge from the tobacco industry, it is possible to achieve great things for our countries. It is possible to save lives. And that is the most fulfilling thing in the world. And so when a tobacco control law comes into effect, you've changed the whole population of the whole country at one go. So let us not give up. Those who are facing challenges where looks like it is taking very long, eventually something is going to change and you will be able to get your law. So just keep on working hard at it.
The generous support of Gates Foundation, CTCA, ACBF, and KETCA included. And for all the differences and achievements we have registered in Africa, it is because of them. And we have to thank them for this generous support. And as I said earlier, we cannot continue looking for their support for tobacco control in Africa. And I suggest that tobacco control need to be one of the core businesses of our Ministry of Health and other regulatory bodies. And I also recommend that tobacco control need to be integrated into cancer and non-communicable disease activities in order to avoid duplication and the waste of resources. So what I'm saying is not only for tobacco control, for non-communicable disease in general, Africa is now becoming no man's land, and the tobacco big industries are coming to Africa, and we have to challenge them by asking for meaningful commitment from our leaders, commitment of human and financial resources. Without national budget for tobacco control and non-communicable disease, with the support of donors alone, I'm not sure whether we can make a difference. And for Africa, I think, as some of my friends said, we have to approach Africa Union, WHO, Afro in Brazzaville, and make some kind of pressure on our leaders to give us a reasonable amount of resources from our national budget for tobacco control and NCDs. Thank you.
I think Africa has got some of the most inspiring people in the world, and we are just proud to have you among our colleagues. So I have seen some of the people ask the question in the chat channel. So I would like to invite them to go through, to scroll through the panel, and the questions that are not being answered in the video have been answered by some of, I see, most of the questions have been answered, and I would like to invite all of the people to come back to this question. And again, before I conclude, I would like to invite to say that we will have our next webinar will be on 26th of August. So there we'll be talking about how to make tobacco control policy work for Africa. So I'm inviting all of you, and I'm also inviting you to spread the word so that the next webinar, we would have many people as much as possible. So to conclude, I'm wishing you to have a blessed day. As Rachel said, we should not give up or not feel discouraged. I'm inviting you to keep the momentum, to keep the fire burning, and for sure, together we will be able to overcome. Thank you very much. Have a blessed day.